If you'd go ahead and start. You are quick on the draw. Thank you so much. Hello, everyone. This is Deb Anderson with Mountain Pacific Quality Health. Most of you know who we are, and we've done a quick-in-R before, but I just wanted to remind you that this is minimum necessary time and attention. So thank you all for joining us in person. We will record it, so it's available to all of the 1815 clinics that we're working with. And we're just going to review the Wyoming Chronic Disease Assessment Tool. This is an annual assessment that Laren and Sandra will tell you a little bit more about in just a second. We will be able to do some Q&A at the end, I think. And again, this is being recorded for everyone's benefit. So basically, all we're covering today is the measuring success with our assessment tool, and then just a few quick updates from our team. So at this point in time, I'm going to turn it over to Laren and Sandra from the Wyoming Survey and Analysis Center called WYSAC, who provides and supports the annual assessment tool. Go ahead.
Yeah, so I am Laren Despain. I'm the lead evaluator for what we call the 1815 project. That 1815 number is attached to a CDC grant that funds a lot of chronic disease work across the state of Wyoming and all the other states too. A lot of that work is focused on helping health systems do a better job of screening people for heart disease, high blood pressure, prediabetes, or diabetes, and then taking action on that, like referring them to specialty care, like a diabetes support program or diabetes prevention program. And we have two important ways that we touch base with health systems to learn more about what's going well and what could be done better. That's my job as an evaluator, is to help people like Deb and the Department of Health folks on the call see what's going well and what's not. And Sandra and I can be that sort of outside perspective. Sometimes people are a little more comfortable talking to us. That's why part of the assessment is interviews. And Sandra and I have had an interview with people from most of the health systems that we understand Deb and Brandy are working with. So thank you very much to the people and facilities who have agreed to participate in those. We tried to make them painless in an hour or less. The other important part of touching base with health systems is, like Deb said, the Wyoming Chronic Disease Assessment Tool, affectionately known as the WCDAT. It's federally funded, so we've got all sorts of acronyms floating around. It's like an unwritten requirement for federal money. The WCDAT, a lot of you have probably done this before, but for anyone who hasn't, we call it a relatively short online tool, but when we say short, we're referring to the time it takes to fill it out. It might take a while and some collaboration to actually fill out, get all the information to fill it out. But once you've got the right person in the room, right people maybe walked around the office a little bit to get answers, we don't think it'll take more than 10, 15 minutes to put in the information about the policies you have in place, changes you've made over the past year. By year, I mean 2021. That's not what the CDC wants, but we've adapted to match to what health systems are looking at. So we've done what we can to make this as painless as we can too. I guess I'll pause for any questions about the WCDAT or the interview process. And if you haven't already received a link to the WCDAT, Sandra actually has something set up to automatically send that later today. And for anyone watching this on recording, that's April 28th.
So Laren, we do have someone, I believe, who has completed the WCDAT, if Tiffany wants to come off mute and share her experience with us. And then we also have two folks on with us who are not the recipients of the emails for completing the WCDAT, but are part of the organizations. So if, Jerry, I would tell you that Kelly Hoblet is in charge of doing your WCDAT, And Lonnie, I'd have to look it up, but I'm not exactly sure who we've assigned from Ivanson, but we might have to look at adjusting who is receiving the emails. So Tiffany, are you okay sharing how your experience?
Sure. There wasn't really an experience. It was super easy to complete. It took me a couple of minutes to pull some reports and get some numbers. But other than that, it kind of brought the knowledge to the surface for me on kind of where we sat on some of those things. So it takes no time at all for it to be done.
Thank you. I appreciate that very much. Lauren, were you thinking we wanted to show people the actual tool, or should I go to the good stuff and let Amber talk a little bit about the support funding?
So I can do a quick preview except that I'm not able to screen share at the moment. Let me try again. All right. So I think you are all looking at a web page. So we start with an introduction that has some information, contact information for me in case you run into problems doing this. And if I'm not the right person to answer your question, I will know who to ask. And then I'm just going to flip through it. Oh, sorry, this is the wrong tool. You guys don't want to do the pharmacy tool. Let's see, I think I closed the wrong survey right before the meeting. Sorry about that. All right, so now I think you're looking at a preview of the WICT app. So it has a lot of information, like unique patients. That's important to keep in mind. Try not to double count people. So if you screen someone for all 4 of these conditions, that's awesome. Just don't count them 4 times. Information for Sandra, who is actually the better person to reach out to if you run into technical problems with the survey. And then Deb has contact information here in case you get to a question and say, oh, I don't know what that means. She might be someone who can do that or help you pull the data from your EHR. So flipping through some information about your organization and your EHR, patient count. We've really tried to keep this to the bare minimum of what CDC really wants states to report on. So now here's a page about information about prediabetes, or if you don't want to stick that label on someone, people who are at risk for developing diabetes.
Laren?
Are you moving ahead in the survey? Because we still see the front, the information section.
I moved ahead. I don't know.
I want to just try to
screen sharing
stop sharing and reshare again. That might help, Lauren.
Yeah, I'll share a different way. Right. Now are you on the diabetes page?
Looks
Okay.
good.
2 years of Zooming and I still run into that didn't work like I wanted. So some basic questions about diabetes. You'll see that sometimes when you click yes, there's a little bit of a follow-up question. So if you click, so answer honestly, just don't be surprised if that makes the survey get a little bit longer. And then a page about hypertension. And the age ranges are different for the different diseases based on CDC expectations. And that's it. So like I said, the tool itself, we've tried to keep short and sweet. And Tiffany, thank you so much for sharing your experience. And as an evaluator, it gave me a internal smile to hear you say that you were filling out the tool and thinking about what you were doing as a practice. So it's great to hear that even just using the tool as a way that you're using the evaluation. So, because even I want this to be more than just checking the box for CDC reporting. So any questions for me?
I just have a couple things to add, Laren.
Yeah.
First, if you have already completed the WICDAT, you're not going to get bugged with another link or reminders or anything. You're off the hook for this year. So don't be surprised when you don't see a link in your email if you've already completed it. And a couple other things. So if you run into the situation where someone else should really be filling out the WICDAT than who we sent it to, let me know. It's really easy to send out a new link. And if you submit the WICDAT and you're like, oh no, I did something wrong and I need to fix a number or something, you can let me know. I'll resend it to you and all the information will still be in the form that you submitted. So all you have to do is change that number and resubmit. So it's quick and painless. So don't worry about making mistakes. We can always work with you on that.
Anything else? All right, so I just want to close with another thank you. I'm sure the entire 1815 team is really grateful for the time and effort that goes into getting the information for the WICDAT, completing it, and participating in the interviews. But you don't have to take my word for it. So Amber.
Hey, thanks, Laren. Good morning, everyone. I just wanted to quickly highlight that we are offering compensation for completing both the interview portion of evaluation and then the assessment portion that Laren and Sandra just went over. So we at CDPP, I'm sure everyone, we understand that completing these evaluation parts takes time out of your day. And we want to acknowledge that by reimbursing you up to $2,000. So in order to receive those funds, we just need a current W-9 and an active SAMS registration on file. No contract is necessary, excuse me. So our program will pay directly once each of the evaluation parts is completed. We already have payments out for clinics that have completed the interview portion, and then we're working on the assessment payments right now. So if you have any questions about that, please feel free to shoot me an email or give me a call. Thanks.
Do we have any questions from anyone who would like to come off mute and ask Laren, Sandra, or Amber a question? And certainly reach out to us if you have any questions regarding who would be completing this at your organizations. Again, we're very happy to make adjustments so we can get as many completed as possible and share that wonderful funding as well. So really quickly, we have a few updates from the team. One is that we have started a program called Community Cares. We have done an event in Lander for the Fremont County area back in November. It was kind of the pilot project and it went very well. I think it was mostly because people were so tired of being cooped up from COVID that they were jumping up and down to get out and see people. But the purpose of the events are to bring together our community-based organizations and resources with our healthcare providers within the communities to make the connections, because we realize so much has changed with the pandemic. We actually did another one in Laramie and have had some amazing responses from folks who came and networked basically at the event. We are looking at doing this in other communities, including Sheridan, Wyoming in June 2nd, and I'm working hard on making that happen here in my wonderful community. And so if you guys have any questions or concerns or comments, or ideas for other communities for us to have them in, I can think of a few right now, seeing who's on the call with us, please reach out and let us know. The other thing is Mountain Pacific, MP is Mountain Pacific, for those of you who don't like my acronyms, are going to take some of the information from those communities and continue to work on our community coalitions, where we are utilizing some of the data that's provided us from CMS, basically different data sources, but a majority of the data can be found in the CMS Medicare claims data regarding concerns, areas of improvement within the communities, and then let those community groups come together and look for things that they believe will make a difference within their communities. So again, if you are unaware of the Mountain Pacific Community Coalitions and the participation agreements for that, please reach out to Brandy or me and let me know. And with that, we just have one more question slide. So I'm going to actually ask for questions, but make sure everybody gets to see the smiling faces of our Wyoming Department of Health CDPP program, who sponsors all of this work and organizes it with the CDC. So do we have any further questions before we sign off today? All right, we appreciate your time. Happy you're able to join us. Let's go ahead and stop the recording, Brandy. I think we're good to go. You all have a wonderful day. Thank you so much.